It's no doubt that the holiday season is a time of caring. It's the one time of year we actually seem to take time to put others first and allow their needs to become more important than our own. But that generous holiday spirit is something that Senior Care Centers experiences all year round.
Lily Ford knows what it takes to help people heal.
Love, understanding, willingness, kindness, faithfulness. That's what makes a good caregiver.
The 70-year-old has dedicated her life to caring for others. But recently, an unexplained and severe spinal infection caught Lily off guard. She was suddenly the one in need.
I had to have the extended medicines, vancomycin. I had a PICC line in my chest, and it had to be professionally taken care of there.
Instead of sending Lily home, doctors at Presbyterian Hospital referred her to Senior Care Centers of Rowlett, one of 36 skilled nursing facilities in Texas that specialize in transitional care.
Our goal is to assist the patients that come to our facilities to get better quickly, to get better and feel confident, and to get back home just as soon as they can.
In order to reach that goal, each patient is assigned a team of doctors and nurses who help develop an individualized treatment plan.
We streamline that care specific to each resident so that it's very catered to each individual need.
Surprisingly, there's a growing need for such specialized senior care. According to the census, there are currently 2.5 million Texans aged 65 and older, and the Department of Health and Human Services estimates that 1.8 million of them, a whopping 70%, will eventually need some type of long-term care. Shortened hospital stays seem to be the driving force behind a greater need for long-term care.
You go to the hospital, you may be very ill, you'll be there for a day, 2 days, and they're ready to send you home, and you're not strong, you're not ready to go there yet. You still have medical needs, you still need nursing care, and our job is to meet that need.
Ms. Johnson, welcome to Senior Care Centers. Your physician has called and he would like for me to start this IV.
It's no secret that as we age, our ability to heal from an illness or injury is impaired. Senior Care Centers focuses on solutions that can speed the healing time, such as intravenous therapy.
Intravenous therapy might be required when a patient suffers a long-term or short-term illness that requires them to be hydrated, or to provide them with antibiotics at a time when they're having an infection. This is going to go into your arm, and then I'm going to attach the tube to it, and that's what's going to give you your antibiotics and your IV hydration.
Nurses work around the clock to ensure patients receive the desired dose of medicine.
Sometimes intravenous therapy can be administered 24 hours a day until the therapy is completed, and sometimes it might be just that we need to administer an antibiotic, so it could be 4 times a day or twice a day or sometimes just once a day.
But physicians and nurses aren't the only ones dedicated to the care of those recuperating at Senior Care Centers.
We have pharmacists affiliated with Senior Care Centers. We have a whole team of consultant pharmacists that is they're in all of our facilities, and they review every patient's medication regimen, medication orders, at least a minimum of every month.
Pharmacists' involvement in patient care is a critical component to the recovery process.
There's so many changes in medications that can happen in the hospital setting, and some of them can be quite dangerous, especially for the elderly that may have reduced capacity, and we make all kinds of recommendations for changing doses, changing medications, including maybe some extra lab monitoring, whatever it takes to keep that person safe with those meds.
Medication management is so important to Senior Care Centers that they've partnered with Texas Tech's School of Pharmacy in Dallas to help train the next generation of pharmacists.
There's so many changes that happen with our bodies as we age. Our kidneys don't work as well as they used to. Our livers may not work as well as they used to. And medications, that is how they're broken down in our bodies, is usually by our kidneys and our liver. And medications don't change. It's our bodies that are changing, and we have to really be on the lookout for potential side effects and adverse effects as we change.
And Senior Care Centers has an equally aggressive approach to wound care, a common ailment among the elderly.
It could be something as simple as having an orthopedic surgical procedure in which there is an incision that did not heal appropriately, or it could be something as small as a non-invasive nick to the toe that turns into something more involved due to the process that's caused by diabetes or poor circulation.
Senior Care Centers uses multiple therapeutic techniques to promote wound healing, including therapeutic pressure relieving surfaces.
We've placed you on a therapeutic surface.
Specially designed beds, chairs, and cushions provide firmness where the body needs support, and softness on bony parts where the skin can easily break down.
Once you press down on it, how your hand springs back up, that's that pressure relieving property that it has, and it will do the same thing for your entire body. As you adjust, if you turn one variation left or right, the mattress is going to sense that as well, and it will readjust itself.
And there are more state-of-the-art techniques as well.
Negative pressure wound therapy is a system in which a vacuum-like pressure is applied to the wound bed. It promotes skin repair, cellular regeneration. It also reduces swelling in that area. It's a closed system, so therefore it makes the wound heal properly.
No matter the treatment, the setting is the same. A comfortable, friendly, home-like environment. A defining difference between senior care centers and more traditional hospitals.
Oftentimes, in clinical, sterile type settings, there's a lot of anxiety. We typically call it that white coat anxiety, and it's just the way that our brains are geared.
Being able to be in a home-like environment just makes that recovery time go faster.
Lily Ford couldn't agree more.
It don't make you feel uncomfortable to be here. When you meet people that show you that they care, they got a smile, they got joy.
After a short 2-week stay at Senior Care Centers of Rowlett, Lily is back to her old self and looking forward to once again helping others.
I never rung my bell that no one wouldn't come, and that my care was good. That kind of gave me joy that someone was doing something that I love to do, and it was all good for me.
Senior Care Centers works with hospitals throughout the Dallas-Fort Worth area. Patients being discharged from the hospital who aren't quite ready to go home can ask their physicians for a transfer to a Senior Care Centers facility. In addition, Senior Care Centers offer long-term care and assisted living. If you'd like more information about Senior Care Centers, please call Judy Garrett at 214-252-7609 or log on to seniorcarecentersltc.com.